The appeal of the Always events is it's focused on what matters most to patients.
And because the feedback from the patients is instant, the changes happen there and then. So it wasn't an issue getting staff engaged at all.
For me, Always events are a way of really ensuring that we are doing the best for people who use our services and their families and carers.
What we have seen is a tremendous impact in terms of how service users and staff have responded to the initiative.
Feel like I'm part of
you
care, yeah.
We were inspired to develop Always events by Kate Granger and her campaign to get ourselves to introduce ourselves to patients and carers, and it struck us that while introducing ourselves is really important, it wasn't the only thing that should always happen. And Kate really liked the idea, but Kate was also very insistent that whatever we did should really be owned and developed by staff and patients themselves, and it shouldn't be imposed from above. And so Always events was a perfect methodology, reminding us that certain things always needed to happen, but what you pick as an Always event is decided by your staff group, your patient group, your carer group, and they work it out together. And it's proved to be enormously successful in those trusts and other NHS organisations who've tried it.
What we did is we looked at a lot of the complaints on the ward, the friends and family responses, and then we asked several questions on the ward. We asked the question of what would make the patients feel safe and cared for. Out of this came 3 themes really. One was the answering of call buzzers, medication and delays in receiving medication sometimes, and also the communication with relatives. The thing that we're concentrating on at the moment is the call buzzers, and what I've started is running some workshops with staff and patients. So for example, yesterday I had 2 staff members, a trained nurse and a healthcare, and 2 patients. Because obviously it's a respiratory ward, the patients were quite breathless, so we stayed at the bedside and we discussed how they felt when there were delays in their buzzers answering and how it felt to be breathless. At lunchtimes we allocate someone for buzzers, so another time they mentioned was first thing in the morning, that's always extremely busy during handover, so we look to allocating a staff member to do buzzers at that time. We're hoping to have made lots of small changes. With the involvement of patients, I hope that they'll feel more involved in the way that we make changes on the ward and improve communication. The staff and patient workshops I feel are very important for raising awareness, and then to use these examples in the future for how we develop care on the ward.
So for me, what the Always events enable the magic mix. They enable people us to really understand what really matters deeply to people, and then provide that environment for the people who are using the services, their families, their carers, and some of the people who are providing care at the point of care, to create a core design team to enable that to happen, to come up with some ideas for improvements or some change ideas.
What I've seen is that staff have really embraced and owned the initiative and been able to work with service users, people who use our services, in true partnership, respecting, listening, paying attention to the things that are really important to the people that use our services, and that really optimises the opportunities to improve care, put people at the heart of everything that we do.
Our Always event was around I'll always be supported in moving on in care. They came up with fabulous ideas, like it would be really good if letters came with photographs on them so we knew who was going to come and see us, or if there was been a change. So what the team did then was they absolutely redesigned that, so all the letters now have photographs on them.
You know, when your idea was chosen, how did you feel about that?
I felt chuffed.
Yeah.
For me, it's kind of Always events is get involved because it's the right thing to do, and it'll design something that will work and that will be sustained and you can then spread.
Always events has proven to be a really effective programme, and I think there's 2 particular reasons for getting involved. The first is that they really come with ownership from patients and staff. They're focusing on things that people think matter, and they're developing changes which people are really committed to delivering, so they last beyond the improvement programme. But second, also the involvement of the Institute for Healthcare Improvement and Picker Institute have really added value to this programme. They come with a lot of knowledge about what other healthcare organisations have done, both in the NHS and overseas, and they come with some really good ideas about how we can measure the effectiveness of the Always event without adding lots of cumbersome new methodology. So I think those are two particular ingredients that I'd recommend and that people have found really valuable from the programme.